I was intoxicated 7 days a week, 24 hours a day.
I've seen so many people die. I couldn't bear the thought of my kids having to write my obituary.
One critical thing in the history of the Sisters of Charity of St. Augustine, and also in St. Vincent Charity Medical Center, is responding to the needs of the people that we serve. And we are very proud of that. Our challenge has been to be risk takers. We began at St. Vincent Charity in the 1950s, Rosary Hall, the first hospital-based treatment center in the United States.
Rosary Hall is integral to this institution, has been present here at this site for over 60 years. During that time, it has served as a leader in its approach to the treatment of the addicted.
The first hospital-based detox unit, the first intensive outpatient program, the first treatment of pregnant women affected with cocaine, the first treatment program to adopt medication-assisted treatment.
And as we all know now, with the emphasis in the community with the opioid crisis, we are the absolute leader, not only in Northeast Ohio, but in the state of Ohio.
When I came to Rosary Hall, I realized that I was a full-blown alcoholic and an addict also. And here's where I realized that my life had to change.
I was a teenager that said I would never use drugs, but I spent some drinking and eventually that wasn't enough. So I sort of moved up the ladder of drugs, experimenting with marijuana and cocaine, and eventually led me to heroin.
What we really need to do is treat addictive disease like we treat other chronic diseases, like heart disease, diabetes, or emphysema. A patient has to decide they have it. We have to teach them how to make changes in their life. We have to provide medications as needed, and then we have to support them on a daily basis as they go about making those changes in their life.
I had no understanding whatsoever what I was going through. I never had experienced a withdrawal of any kind. My nurse took the time to explain to me what I was going through and that it was not going to be easy. But if I did my part, she will help me get through it with a medication. And so she did.
They taught me unity, and the group members here, the counselors, helped us to support each other.
In the 12-step program, they show us that we have to have a spiritual connection that is important and imperative for our recovery.
I was what they call a functional addict. I went to work. I got sober. Not sober, I didn't use for a while. It was my attempt to control it. Until I finally learned that I had to work the treatment program, I kept relapsing.
We feel Sister Ignatius along the hallways here. It's my foundation.
Parents are burying their children. Parents shouldn't have to bury their children. It is the responsibility of St. Vincent Charity Medical Center and all clinicians to make people aware of the devastation that this opiate addiction carries.
We handle currently 16% of the state's inpatient opioid treatments. For a singular hospital of modest size in Northeast Ohio, this is an incredible statistic.
Rosary Hall is addressing immediate needs relative to this epidemic with a transportation program, partnering with Uber to be able to go out to sober living homes and bring those people to our intensive outpatient program and then bring them back to their homes. We're working with Cleveland State and other institutions that will focus on research related to this disease, will focus on education, which is critical, it'll focus on community engagement, and it'll focus on informing policy so that we can have an even greater impact going forward.
As we look at the scope of this problem throughout our community, we need the partnerships of everyone in the community, private and public institutions, and our governmental institutions. The Sisters of Charity's mission is exemplified for the good work it does within Rosary Hall.
There's no other place like Rosary Hall to see that yes, I can, and you will. That's what Rosary Hall did for me.
Rosary Hall really saved my life. I want everybody to know that they can do this and to come and we can help them.